We are in Warwick Hospital here, and we have so many wonderful acute hospitals around. You and I want them to survive, but truthfully, do you really think if we don't get dementia care right in hospitals, do you think they will survive? In my mind, if we don't get the dementia care right, that will not only cause problems to our beloved Warwick Hospital, but to all the acute hospitals, to all the NHS. The whole system could collapse.
This is really an opportunity for us all to do something different. We have to have flexible, innovative services that meet the needs not only of the patients but also of their families and their carers within hospital or community settings. There is so much experience in this room, hundreds and hundreds of years worth of experience in this room, and you guys must have most of the answers to what we need to do. And so really we need a concerted effort moving forward to think about what that innovation is and take that forward and share. I don't mind stealing ideas from people. I think necessity is the mother of invention, and therefore if you've got a great idea over there, I think I'm going to borrow that.
As a matron doing my rounds, I'd quite often see and hear every morning, "Sit down, Margaret, sit down, Bill, don't go there, Bill, come back in here," because the nurses cannot be by the side of the patient all the time due to lack of resources. DART, I think, is my other nurses that I haven't got on a roster, but there are systems that I have that I can use that are available to me. DART is not about old people. DART is not about this thing that will support one-to-one care in the wards. DART has got lots and lots of different uses. You just need to think outside of the box.
One of my colleagues is a trainee nurse practitioner. It was his time to do a femoral block. I said, right, we'll go in and do it together on a gentleman who's got dementia, who'll come in, fractured his neck and femur. Very, very distressed. So we used the My Life to the top end of his head. We talked about Elvis, we sang a little bit. It was great for the patient, it distracted him enough so that then, and listening to Elvis also helped Terry put the femoral block in as well. So it has benefits for both trainee practitioners and the patients themselves.
We were recruiting volunteers through the standard hospital process. They didn't really get it. And then along came two wonderful young people, and over a very short period of time working with us, they convinced me that we could engage with A-level college students for 2 years to work with older people. The first year we managed to recruit 28. Last year we had 68 young people coming in to 6 hospital wards. So we managed to get a 7-day cover. The students not only develop skills in working with older people, in working with doctors, in working with nurses, learning all the jargon and getting coached for interviews and all kinds of things, but they're developing skills in leadership as well.
Something that's come across really quite strongly to me today in terms of whether you're here from an NHS organisation, you're here from a voluntary organisation such as myself, we're all facing all of these same challenges. We're all talking about budget cuts, we're all talking about resources, we're all feeling the effects of the ageing population and the population that we've kept so fit and active that there's just more and more people to support. We've all talked today about about activities, about meaningful experience, about the making sure that people aren't just sitting there feeling isolated, feeling lonely. And people have asked about innovation and what we can all do and things like that. And I actually just sitting at the back, reflected before lunch and thought actually the moral obligation from today for me is, whilst we perhaps can't change it all overnight across the whole of the health and social care economy, there's something we can all do as individuals about going back into our own families, our own circle of friends, and actually just taking that bit more time with people that we know, people that we perhaps don't ever sit and just have that chat with and just reflect a little bit. And I actually think if we all go away and do that and actually start from our own communities, we might actually see a lot less people being admitted to hospital because they're isolated, because they're lonely. We might all have a much better understanding of what works and what doesn't work.